Diffuse Tensor Imaging, or DTI, is a special technology that we've started using in our brain injury cases. In the cases that warrant it, where people have more significant deficits, we want to look at what is being shown not only on the MRI, but also on the DTI study. DTI is done in an MRI unit, a high-resolution MRI unit, and we can look at the physical tracks of neurons that go from the spinal cord or the brainstem into the brain and then back out again. We can look at things like the corpus callosum, which is essentially the superhighway between your left and right lobe, and we can see if there's damage there. And amazingly enough, we have seen some things in DTI that you will not see in MRI, because you'll see actual damage to the tracks of fibers that go between the lobes or from the middle of the brain out into the right or the left hemisphere. And so it's important to see this because we can now tell in a large number of cases that there is physical and objectively provable damage to our clients. One case, we had an MRI that looked largely normal, and we ended up with a DTI that showed a large hole in the person's corpus callosum, which is essentially the communication center between the right and left lobe. This is a client who worked at a very high level for a large corporation, communicating and doing things in multiple different countries, and she had a great difficulty doing that type of complexity afterwards, and eventually had to resign from her job as a result of the traumatic brain injury. That would have been missed had we not done the DTI.